is a self-made orthomolecular doctor. Was a medical officer, government physician during the pandemic. A maverick in integrative medicine practice. These awards, Lifetime Achievement Award, concern doctors and citizens of the Philippines. Outstanding Civic and Humanitarian Advocate, Dangal ng Bayan Gawad Filipino Award. Outstanding Health Advocate, Public Attorney's Office. Heroes Transformative and Exceptional Medical Doctor of the Year. And to be awarded this afternoon, Asia's Modern Hero Awards 2023, which will be awarded today, February 17, 6 p.m. in Okada, Manila. And his Lifetime Achievement awarded by CDCPH for treating over 100,000 patients with COVID during the pandemic. I would like to call on stage Dr. Allan Landrito, our next speaker.
Good morning to everyone. 2 weeks ago, a close friend of mine was calling me. I would like to told me, Doc, he called me, Brad. Brad, 4 months ago I have this dog, and this dog had a lump on it. I could not put the list because the lump was as big as a coconut. No, the coconut without the husk. And the dog was dying. The dog was dying. He could hardly eat. Any day he will die. And it so happened at that time, her wife also had a size of a ping pong ball, tumor here, down here, based on the angle of the jaw. So what he did, sabi niya, I gave the dog 1 capsule of Ivermectin a day. I gave my wife 2 capsules of Ivermectin a day. After 4 months, both tumors were gone. Wow, I was so amazed. I was fascinated. I was amused at what he says. I was laughing also. Yeah, so, before anything else, of course, disclosure. I have nothing whatsoever with Big Pharma. If Dr. Maravik has allergy with Big Pharma, I'm having anaphylaxis with them. And of course, before anything else, I would like to congratulate and give a very high commendation to the Philippine Society for Orthomolecular Medicine with the dynamite president who is instrumental in bringing this forum to us today, Dr. Homer. Thank you very much, Doctor. And so timely that he gave us this theme, harmonizing modern medicine with nature's remedy. I was saying, what is Dr. Homer thinking? Are we going to be arrested again? Kasi FDA certainly doesn't want nature's remedies. No? Department of Health doesn't want it, WHO doesn't want it. Anyway, we are already breaking barriers. Just now, Dr. Taguda was broken again through introduction of homeotoxicology. And yesterday, there was Dr. Mila and Dr. Rafi and the others. Now, my part is about repurposing drug as an orthomolecular against cancer. What is drug repurposing? It's also another term. Drug redirecting, drug reprofiling is defined as identification of double uses of existing drugs. The development risk, cost, the safety-related failure are reduced with this approach. Because this drug have already established formulation development, in vitro and in vivo screening, as well as pharmacologic and pharmacokinetics profiles. And what is orthomolecular medicine? We know all that. We all know that. It includes finding the right molecule that can address a particular disease condition. What about the word cancer? What is the closest word you can find with cancer? For me, it's death sentence. If a person gets a diagnosis of cancer, it's like getting a death sentence. I hope you will agree with me. And I think you will do. I was looking back on my textbook in pharmacology, that's Robbins. I had a third edition way back 1984. And I look into neoplasms. I read in the first sentence, part of that sentence says, individuals learn for the first time that they have some type of cancer, but fortunately, most of these tumors can be cured. I believe 32 years in practice, I don't agree with that. I don't know with your experience, but I have seen really, cancer is really a very difficult problem. Very difficult. Why so? How can we understand it? We have to go look into what are cancer cells. What really are cancer cells? What we are building here are the cancer cells. These cells are cells that have acquired the ability to escape death. The first successful attempt to immortalize a cell was when they got cells from cervical cancer. Now it's called the HeLa cells. And after they have gotten it, those cells are immortal. You just have to put the right medium and it will be immortal. And they just have to share it, culture it, And this is the kind of cell we're dealing with. We're dealing with super cells. Have eluded, have escaped apoptosis. I will talk about apoptosis later on, but it's about programmed cell. But every cell in our body have a programmed cell death. For example, the red blood cell. There are two pathways actually, extracellular and intracellular. The extracellular pathway has to do with death-mediated receptor. Death receptor mediated, like for example, the red blood cell, the spleen will find out, oh, you're already 120-year-old, I have to sequester. So that's one way, that's the external. The internal is it is mitochondrial mediated. The mitochondria will determine that the cell has to die at a particular time. But these cancer cells, they have escaped that apoptosis. And another thing, those cancers have uncontrollable mitosis or proliferation. They just proliferate. That's why the cells just build up and mitosis 2, 4, 8, 16 becomes exponential. So it grows so fast. And another thing, they acquire the capacity to resist therapy. Sometimes some people they say, oh, now you're declared cancer free. And the next, after a few years, can get that same tumor. They give the same medication, it doesn't work anymore. It has resistant therapy. And that cancer has the potential to truly relapse. That cancer cells have the potential for angiogenesis, invasion, and metastasis. We know that. And another thing, these cancers have an inherent genetic and epigenetic heterogeneity and metabolic plasticity. Given a single organ with different kinds of cell lines, there are so many different kinds of heterogeneous phenotype of and metabolic plasticity, they like glycolysis, but they can go into pyruvic oxidative phosphorylation, and hopefully they won't learn how to live through ketotic environments. But they have greater ability in adapting in unfavorable environments. And these cells have developed the ability to adjust their metabolic phenotypes under hostile environments, and they are called crosstalk. Later on, you will appreciate what crosstalk they are referring here. Between gene regulation and metabolic pathways, thereby resulting in acquisition of therapy resistance and metastatic potentials. Okay, how are cancers treated? Well, we have surgery. But surgery is not for every kind of cancer, right? For example, colon cancer, usually you get cancer, colon cancer, the symptom is obstruction already, it has invaded even the contiguous areas, you can just resect it. Sometimes there is unresectable. So it's cutting out the tumor if it's possible. That's good. No, I'm not for inside to biopsy. If it's excision biopsy, it's okay. You can diagnose it right away. But inside, you just bite it there or aspirate. Problem with that, now they are finding there's a possibility of creating an inflammatory cytotoxins. They call it inflammatory oncotoxin. So the tendency is if you bite it, you open it, having a well-defined border, now you open it, and then cancers can escape. And after doing surgery, what they do, they follow it up with chemotherapy. Sometimes they can do surgery, they do chemotherapy. And what exactly are you doing with chemotherapy? You're putting a cytotoxic agent there, killing those cells. And in so doing, you're also killing the other normal cells, especially the really growing cells. And sometimes they do radiotherapy. The problem with chemotherapy and radiotherapy, what's the problem? Aside from giving us a lot of toxic adverse reaction side effects, you literally kill the cells there. It's like you leave the dead cells there, and how do you eliminate the cells? And that's why the patients go so toxic, because there's no way of eliminating those cells. It's like, to make an analogy, you throw all carcasses like dead dog, a dead cat, even a dead person into Pasig River. What do you expect with the environment will be? It will stink at everyone, will not want to stay near the river. Ganyan ang nangyayari. That's what's taking place in the human body when you do these things. So they have done immunotherapy. They lash different methods in allowing an immune response to that. They give checkpoint inhibitors. For example, there are certain things that put a brake on the immune cells so that it won't attack the cancers. Then the checkpoint inhibitors will just release the brake. They do chimeric antigen receptor T-cell therapy. They do cytokines. They give cytokines. Immunomodulators. They give cancer vaccines. The cervical cancer vaccine. They give monoclonal antibodies. But still, it's not perfect, and there are a lot of adverse reactions also. And then now they have done metabolic therapy. You know what metabolic therapy is? I think a lot of you already know. So it banks on the theory of etiology of cancer, which goes against what we have always known as gene mutation. They believe on mitochondrial theory, mitochondrial dysfunction theory, or etiology of cancer, how they got it. Given normal cells, they have two groups of normal cells. They take out the nucleus from the normal cell and then replace it from a nucleus from a cancerous cell. And from another set of cells, they took out the normal mitochondria, they replace it with dysfunction, with mitochondria from cancerous cells, and they look into what happens, the progeny, offspring of the cells. You know what happened? Those with cancerous, nucleus from cancerous cells gave a progeny of dormant cells, whereas those with mitochondria from cancerous cells gave out cancerous cells. So they were saying it has something to do with mitochondrial dysfunction. And so how do you approach it? Now they propose doing metabolic therapy. And what they have come up is you subject the patient into ketosis. That's ketogenic diet. And the idea is to starve the cancer because those cancer cells will not thrive on ketotic metabolism. Hopefully they don't learn to adapt it because it's working good. But you also put them into intermittent fasting and even prolonged fasting. But there's limit for this. They need to do that to promote autophagy. But there's a limit to that because sometimes the patient is already cachectic, or so much muscle wasting. is already fasting, it's not, doesn't have any appetite, and then you're going to fast the patient. Cannot do that. Now they have developed this, what you call, targeted therapy. Targeted therapy. Okay, with targeted therapy, they look into different substrate or enzymes or metabolic pathways or oncogenes. They target that. It is going to be very expensive if you do that because you need they have to monoclonal antibodies. They have these small molecules like angiogenesis inhibitors and tumor agnostic treatments. But it's working good. But you have to be very specific. You need high technology. In a practical country like Philippines, it's not that practical. Now we have orthomolecular therapy. Orthomolecular therapy is it's like targeted therapy, but my analogy for that is if you do targeted therapy, you need a sniper to kill the leader of that enemy. But if you do orthomolecular, just give them a shotgun treatment and it lower everything. But the thing is, you need a particular molecule, the right molecule that will handle all these cancers. And we will see what I'm talking about. Ivermectin. Yeah, we came to know about ivermectin during the pandemic, but it has been there. That's a SARS-CoV-2 virus. This is the ivermectin I'm referring. And mark this structure, this ring and these three rings. That's common among the ivermectin family of compounds. This Dr. Satchio Moro, when he was collecting this whole sample from a golf course in Tokyo, and they were looking back where he got it, couldn't find it anymore. And that was actually a blessing in disguise because they just have to continue what they have, and then they just have to butcher that one. And they got the Streptomyces aeruginosa, and then they called it Streptomyces aeruginosa. It's from a fungi called actinomycetes. So luckily we have ivermectin, and you see there are different ivermectin family groups, and they are so different from each other, except for the three rings that I mentioned. And among all these, they have found ivermectin is the most safe and the most potent of all. So I've been showing these properties of ivermectin during my Zoom meetings during the pandemic. That's for properties anti-parasitic. You can see it has broad spectrum from filaria or from roundworms, from many to parasites. It has a broad range of antivirals. Just a partial list. Philippines is ridden with dengue. And I'm saying, even without ivermectin, the orthomolecular for dengue is vitamin C. Just have to give high enough. No one should be dying from dengue in this country. And now we have not only vitamins, but also dengue, ivermectin. And you can see down there, there's HIV, and then SARS-CoV-2. And then it's also an immunomodulator. It works perfectly as an immunomodulator for autoimmune disorders. We've been giving ivermectin for immune disorders and we're getting good results. And lastly, it's anti-cancer. Here I want to show you how well-rounded ivermectin is. It addresses cancer stem cells. It can be used with combination therapy with the chemotherapeutic agents, and it even reverses multiple resistance. And then it promotes cancer cell death in these three ways. These are the normal ways. I mean, the proper ways of disposing, killing the cells. No? Apoptosis, autophagy, and pyrolysis. Not by chemotherapy, just leave the carcasses there, and then it's just polluting the system, giving toxins. And then, most importantly, ivermectin goes against that PAK1. That PAK1 is responsible for so many different other pathways, and the effect is anti-cancer effect, affecting the cell cycle, arrest, suppression, proliferation, metastasis, and angiogenesis. Now, I will explain a bit of this about this cancer cell death, and you will understand that it has to be the proper way of disposing after you have killed the cancer cells. Okay? But before that, I would like to mention to you that ivermectin is directly attacking or inhibiting PAK1. PAK1 stands for protein for P21 activated kinase 1. Okay. And they have found out 70%, and I say again, 70% of all known human cancers is going through that pathway. And if ivermectin is inhibiting that, what do we expect? Then ivermectin, I suppose, will inhibit 70% or more cancers. No? So it's an orthomolecular medicine. And you will know later on it's not just 70%, it's more because there are other pathways that it will attack. Let's go on with apoptosis. I have given you this handout, so you can follow through to this handout. If I will read it, and they will lack time for that. I just would like to explain apoptosis program cell death. The cells will have to die by itself according to program para hindi na escape yung cell death. But it has to, for this to proceed, you need PARP, that's poly-ADP ribose, must be polymerase, and caspase 3. You need those two separate too, just like a switch for apoptosis. But in order to have that apoptosis, you need caspase 9 from procaspase to the apoptosome of which is to be activated by cytochrome. But as we mentioned earlier, in cancer cells, the mitochondria is already dysfunctional. So if you introduce ivermectin, it easily passes by phospholipid layer of the cell membrane, and upon entry it produces reductive oxygens, which is attacking the mitochondria, bringing down the membrane potential and regulating the box and down-regulating the basal protein. Thereby it will release a cytochrome. Upon release cytochrome, you get apoptosis. Okay. So that's a little bit of molecular biology. Autophagy. Auto means self, phagy means eating oneself. You know, cancer cells, they have to find a way. The cancer cells have to escape autophagy, but then we have to restore autophagy. How did cancer cells escape autophagy? What is responsible for autophagy to take place? You have to have the formation of an autophagosome. An autophagosome is produced by nucleation of a phagophore, and it's being triggered, the formation of it's being triggered by this complex protein of assembly of autophagy protein they call of pectin 1, and Dr. Barabig mentioned phosphatidyl inositol 3 kinase complex 3 protein and autophagy 14. We need that assembly to create autophagosome and thereby bring about autophagy. But there is one particular protein which they have found that becomes so much, I mean it becomes, the presence is seen in many cancers of mTOR protein. That mTOR protein is just inhibiting this assembly of autophagy complex, no? Of this autophagy assembly. That's why it doesn't proceed. So this is exerting an inhibitory influence. So that's why in targeted therapy they target the mTOR protein. And they're really successful in doing that. But then when you introduce ivermectin, again it attacks the PAK1. This is one of the pathways of the PAK. PAK is a protein binding for AKT. If it's bounded there, then mTOR can just completely inhibit the formation of autophagosome and autophagy. But if you introduce ivermectin, we detach PAK from AKT. Upon detachment, PAK will undergo 3 stages of ubiquitination, and then after that, it brings it to the proteasome for proteolysis of that protein. The proteasome will respond for proteolysis of protein, and what happens to AKT, it becomes phosphorylated, thereby it will phosphorylate the mTOR. If it's phosphorylate mTOR, then it inhibits the inhibitory influence of mTOR, thereby the disinhibit siya. If it's disinhibited already, then autophagy can proceed. Okay, why I'm showing Moai head stage. This is in a very isolated islands in Chile, the Easter Island. Are you familiar with that? Now let me ask, is there anyone here who's familiar with rapamycin? Can I have a show? Yes, there's one doctor, Dr. Pili also. Rapamycin is coming from another actinomycetes, and they got it from Easter Island. And it's Streptomyces hygroscopicus. And why they call this mTOR? It means mechanistic target of rapamycin. And I gave you this, just the first page of rapamycin. You have it. It has commonality with ivermectin, aside from coming from an actinomycetes. They have found that it's really, the title is it's for longevity. They have seen how rapamycin works in yeast, in all different kinds of organisms, from yeast to worms to flies to dogs to primates and to humans. It extends human life. It extends the lives of this organism by suppressing cancer. So it's basically an anti-cancer thing. It's a longevity thing, and FDA is saying it causes cancer. So if you can download this thing, then you will understand what I'm saying, and you will be impressed when you see this article has only 8 pages, but the reference is 12 pages. 202 different references starts on rapamycin, and they're suppressing rapamycin as well, the way they did in ivermectin. Rapamycin actually eliminates hyperimmunity. What happens with autoimmune disorders, there is hyperimmunity, and they brand rapamycin as immunosuppressant. Actually, it should not be immunosuppressant. It should be immunostimulator or immunomodulator. It improves or it rejuvenates immunity. And they have found that it actually prevents lymphoma. One of the most difficult cancers are the lymphomas. And other types of cancers, of course. And it extends lifespan. If, there are different senolytics, I think number one senolytic that we should promote or we should try is rapamycin. Okay. Now let's go to the third one, apoptosis. I've been referring to this earlier. Apoptosis, you can look into the handouts how it is explained there. You need to have where's that? Where I went to apoptosis? I mean pyroptosis. You have to go through a signal transducer on the cell membrane P2X4 and P2X7. But this is being stimulated by a danger signal like a pathogen or a necrotic cell. But this is suspended in cases of cancer. Doesn't work like that in cancer. But if you introduce ivermectin, it will work like a danger signal to allow ivermectin through that pathway to produce a reactive oxygen species acting on NLRP3. Remember NLRP3, This complex of protein will allow procaspase to be converted to caspase, and when you have caspase 1, you will go into formation of inflammasome by converting pro-interleukin 1 beta and pro-interleukin 18 to interleukin 1 beta and interleukin 18. And then another thing, it promotes gasdermin D. And this carbon D will bring about the pyroptosis. That's immune-mediated cell death. So those three are the most important way of killing the cancer cells without having any problem. If you do it with autophagy, the proteins, whatever contents there, it will provide it to the other cells for as building materials. It will not be toxins to the whole system. And you know, if you go back to autophagy, the autophagosome can just engulf anything. It can go so big, it can engulf the whole cytosol. It can even engulf the mitochondria. And if it engulfs the mitochondria, what will happen to the cell? The cell will die. There's no more powerhouse for that cell. And if it sees anything that is dysfunctional, it will just take it out. Now, they have seen how it works in particular cell lines, cancer cell lines. And apoptosis, they have seen apoptosis working more when you give ivermectin. And there are autophagy and apoptosis. You see all the things there. Okay. I would like to show you also the PAK1 pathway. It has a lot of crosstalks with other pathways. And here is the pathway for NLRP. And it is for nuclear factor kappa B, and that's for AKT and TOR. I would like to notice NK and nuclear factor kappa B. What is nuclear factor kappa B? I have given you also a handbook for that. If it's nuclear, then it's in the nucleus. No? It is a transcription factor which regulates an array of genes involving different processes in immune and inflammatory responses. It induces expression of various inflammatory genes, including cytokines. Oh, I forgot to show this. Including cytokines, chemokines, and towards inflammasome regulation. Also, nuclear factor kappa B plays an important role in regulating T cell differentiation. Remember, Dr. was showing Treg, that's regulatory T cell. Nuclear factor B has a lot of things to do with that. And if it becomes dysregulated, we call it deregulated nuclear factor kappa B, it will lead to a lot of aberrant T cell activation, which is associated with a lot of autoimmune and inflammatory responses. So we are seeing rheumatoid arthritis, inflammatory bowel disease, multiple sclerosis, atherosclerosis, systemic lupus erythematosus, type 1 diabetes, chronic obstructive pulmonary disease, and asthma. It's something to do with nuclear factor kappa B. Now, if you look down here, these are all the things that is taking place in cancer, right? So what mediates that is the cytokines, the chemokines, the cell cycle regulator, the adhesion molecules, and the apoptotic. And central to that, pivotal to that is nuclear factor B. So that's why targeted therapy are also trying to attack nuclear factor kappa B. And during the pandemic, what is the most prominent interleukin that causes the cytokine storm? One particular cytokine is interleukin 6. And remember, there is one particular monoclonal antibody they were giving to attack the interleukin 6. What is that? Tocilizumab. It was working good, but it's only attacking interleukin 6. But there are other cytokines that are present in COVID. Okay, let me go to the other pathways. This is the entire molecular mechanisms of damage or effects of ivermectin. You can use so many, signal transducer, oncogenes, substrates, enzymes that it attacks just so tumor will not progress or will not be created. So here is a list of all those. The first three I discussed already, apoptosis, autophagy, parotis, and we have plenty more. Now, I have, to make it easy for me and for you, I provided this guideline. No? Okay, let's go one by one. Yes, associated proteinuria, 1. What is that? It is the main downstream effector of the hyposignaling factor. And I will not go through the details, you can have it, that's why I provided you can read it. We will not time if I have to explain all of it. It is seen in intrahepatic cholangiocarcinoma, cellular carcinoma, combined hepatocellular carcinoma, colorectal cancer, ovarian cancer, and gastric cancer. So it's the nucleus. And you have the WNT cell factor pathway response. There's ivermectin that acting against the WTN. And where do we find it? It's in intestinal cancer, breast cancer, skin cancer, lung cancer, and cancer stem cells. If I go through explaining axicom, cyclin D and B-catenin, it's already explained here, better unit, so we will lack time. And then TF increases TF3 activity. There you are, ivermectin considered with phosphorylation of and thereby activating TF3. This is a zebra transcription factor actually, and it is seen mostly in melanoma. By the way, melanoma is the most difficult form of skin cancer. And then here you have the DDX helicase that ivermectin inhibits, and mitochondrial dysfunction will where is that? Must be somewhere. This is seen in glioma cells where ivermectin will inhibit cell invasion and proliferation in glioma cells, and even glioma stem cells. And epigenetic modulator property of ivermectin. You know, there is this phenomenon called epithelial mesenchymal transition. Many cancers are from the epithelium, not from the mesenchyma, but there is this oncogene or there's this pathway that can convert the epithelial form cancer into a mesenchymal form. But ivermectin will attack that one. This is often seen in breast cancers. And you have mitochondrial respiration. I will explain that. It decreases oxygen OCR consumption rate and decrease the ATP. And they have found this mechanism working in renal cancers, in glioblastoma, in lymphoma, in leukemia, and in breast cancers. And we have this one, the ivermectin acting as an ion for chloride channels. You know what are, first they completely offset osmosis. So there should be a balance of the chloride ions intracellular and cellularly, but with ivermectin just pumps chlorine ion inside, and that will cause that. And what happens there, you will find this actually occurs in acute myeloid leukemias. And here is one, the big lipoprotein. What is that? This is the MDR protein, the multi-drug resistant gene that is getting expressed in many types of cancers that eludes treatment therapy. Okay, cancer stem cells impacts the stemless gene expression, immunogenic cell death. You know, it goes through this pathway. You have to see HMPG1. You can read through na lang kasi we will lack time. And then the MPAK path1. There are other pathways that I have no usual slides for that. The KPNB11 gene, which is seen in epithelial ovarian cancer, and the FOXA1KU70KU80, that's for the prostatic cancer. And this one is for the nasopharyngeal cancers. Okay, different, it's so technical, it's sometimes so confusing to study that. So I just want to show it to you that there are already a lot of studies done on ivermectin, and even on the level of molecular medicine, they have proven it's still working against all those cancer. So it's not just 70%, it's more than 70%. There are so many other, and they're still adding more. All these studies have been there for many years, even before the pandemic. And here's the complete list. And here are the molecular. Now, how do they do it? Of course, they don't do molecular study in vivo, they do it in vitro. It's molecular study in molecules. But what impels them to do the molecular study? Of course, they tried it on different cell lines and they identified the cell lines. And then they isolate the cancer cells and they study it molecularly. So they're doing really very good work. I wonder why no one is giving attention to this. And they keep on giving all the chemotherapy drugs. So there's no money in Ivermectin. Maybe. And there's money with if they continue creating chemotherapeutic agents that will be causing a lot of toxicity in the human system. And there's another list. And there are all the cell lines there. Now I only showed you 3 references, but actually you go through that. Those are reviews, no? They have, one has 114 references, one has 66, one has 67. You will find another treasure trove of information about ivermectin on cancers. Okay, nandyan rin sa handout niya yan, yung references na yan. Now let's take a case in point. Okay. Initial AAD, this is a patient, a female 39-year-old, has a past history of myoma uterine myoma and benign tumor of the left kidney. So nakita niyo meron siyang potential for developing cancers, right? Presented with jaundice, moderate to severe upper right quadrant pain, and hematuria. So what is responsible for hematuria? It could be the benign kidney tumor. Next month, on September 19, they did a CT scan and found mass the size 11.6. I was measuring my face, it's only 10 centimeter diameter. That's 11.6. You can imagine how big is that. Kaya nag-jaundice na siya eh. Diba? And they did the biopsy next month thereafter. It's adenocarcinoma of the bladder. And what she did, she had chemotherapy. That's the option they had. They gave her 6 months on 4 months on capecitabine, 8 cycles. She completed 8 cycles. Nothing happened, so they continued oxaliplatin for another 8 cycles, but she cannot complete it. She became so toxic with all the side effects of hair loss, vomiting, chills, vertigo, phototoxicity, loss of appetite, and a weight loss of 27%. From 55 kilos, she went down to 40. She had chronic skin eruptions. Overall outcome, it's a failure. Not an iota of tumor regression was achieved, and with all the adverse effects. And so, I came to know her. Actually, she's a doctor. And I was telling her, Doctora, why don't you try ivermectin? It has anti-cancer property. And she said, how much will I take? You take the maximum? I don't know. There's no established recommendation for that. So this is what she did. She took, on December 20, last 2 weeks, she took 4 capsules. That's equivalent to 60 milligrams daily. And then after that, she started doubling it. From January to June, monthly, for 6 months, she takes 8 capsules. That's 120 milligrams. According to her weight, that's 3 milligrams per kilogram body weight. That's high. No? What the studies I was showing, they were just giving from 1 to 2 milligrams per kilogram body weight. But this one, she was taking 8. And then monthly, she was taking her ultrasound. The tumor is shrinking little by little. So she continued, and for another 4 months, she took 6 capsules. She reduced it. The tumor was shrinking little by little. And then along that time, she was taking her liver and kidney function test, that's SGPT, and the creatinine, it was all normal. And then she proceeded with 4 capsules. And then along with that, she was doing orthomolecular sodium ascorbate drip, 50,000 milligrams every other day for 6 months. She knew that cancer will not thrive on acidic video, so she alkalinized herself. She makes her own alkalinized capsule made from lime, 1,000 milligrams, 2 capsules 3 times a day. And then she do vegetable juicing, using moringa, camotes, and spinach broccoli. And if one of those is missing, she adds Malabar spinach, broccoli, rosa, bati, 2 glasses daily. Side effects, just visual changes. When she was in January, on the first week of January, visual changes, dimming, glaring, or tunnel vision. We experienced that. We've been priming the patient, you will experience this with the ivermectin. It goes away after a few days. After 5 days, she said, since the body has acclimatized, she's not getting all those side effects anymore. She's sleeping. Ivermectin will induce sleep. And then, total outcome, complete absence of tumor. They did another PET CT scan on October 21, and here's the result. Can you read it? Okay, we can magnify the second page. You can see here, that's October 22. No? She's already 40 years old, that's a year after. And you can see that abdomen, we can magnify that. Look at the third line, the gallbladder mass unseen, previous size measured 8.6. There was a PET CT scan earlier, 6 months earlier, it was 6 already. Let me magnify that. And look at the kidney. The kidneys are normal. Look at the uterus, normal. Nawala na. Even the uterine mass, even the kidney tumor, it's gone. So the impression is unremarkable mass as compared to a CT scan 6 months before that, a found case of carcinoma. Fantastic, right? That's just one case. Right now we're giving ivermectin to a lot of people who have prostatic cancer, including good. There's this guy who is Spanish that we grew up in the Philippines, now in Spain. He has benign prostatic hypertrophy. And when he heard that I was giving ivermectin high dose to cancers, he was thinking maybe it will all work in my prostatic hypertrophy. So he took it, and after 1 month he was telling me, before I used to wake up 5 times at night. This time, after, again 4, then 3, 2, 1, and now I don't have to wake up. I have full bladder empty every time. And it's not working. For 10 years he's been taking pharmacological agents for the BPH and this time. And he became so noisy about this. He's been telling people around. And he's been giving all the senior citizens we have this BPH. And we know what happened. He's got even patients with prostatic cancers, and they were saying, even our prostatic cancer is common. And even the erectile dysfunction that was even addressed. So he was making more noise then. And he was, here in the Philippines, we've been handling a lot of breast cancer patients and wounds. Breast cancers with no hope for chemotherapy or any other thing. Open wounds, you can see the tumor there is bleeding, it's smelling so bad. We gave ivermectin, even on the 3rd or to the 5th, you don't find any smell anymore. The wounds are closing little by little and it's shrinking. We have no case of acute because it takes maybe a year, it will take longer. Okay. So here is the protocol that I propose if you want to use ivermectin. I have given this as a handout also, and head of slides. I would like to mention some other things. I found out that ivermectin, when given this animal study, it lowers the sugar, it lowers the cholesterol, it increases insulin sensitivity. So it's anti-diabetic, and we have seen this work. As an antibacterial, you can see this patient. This is my patient. They wanted to amputate. I gave 6 cups of ivermectin. After 2 months, look what happened. And then she continued, but this time she lowered it. She never told me I could have given her 6 capsules, but she did it. Continued, and last month it's already totally. This is the case of an amputated stump. First they had amputated until they did above the ankle, then above the knee, because the gangrene was progressing. It cured, but then after that, a few months thereafter, it had an infection. And there were 2 stoma from the thigh and from the stump, from the stump itself. It's producing a couple of pus every day. They could not handle it in the hospital. For 5 months they've been giving her intravenous, all antibiotic, everything. They could not do anything. We gave ivermectin 6 capsules a day. On the 5th day he was complaining. Where will the pus go? What will happen to us? We're saying, there's no more pus, that's why you're in the pus lesson. On the 10th day, it was completely dry. And now he gained weight, he lost that. Okay. So I would like to show you the antibacterial. I show you chlamydia. These are only the three available styles on antibacterial property. But look at this one. I have a patient who we saw a patient who had been having hemoptysis. They could not treat him with, it's an MDR case. And the hemoptysis was pure blood for 4 months. I was worried he will die from hemorrhagic asphyxiation or aspiration. We gave Ivermectin. Second day there was no more hemoptysis. And I've been managing I.6 center, and you have MDR. It's very difficult to treat them. Most medicines, they have no shielding effect. They cannot complete the treatment. XDR, there is no treatment, and there are a lot of XDR, but Ivermectin will work against XDR. Okay, that will end my talk. Okay. I just would like to share one message. I got this from the film Beyond Universe. The doctor there was advising his his son, who is a doctor, and he was saying, medicine is sometimes about finding a cure. Oftentimes it's about relief, and it's always about comfort. So during this pandemic, we have seen who are the true physicians for the doctor, who continue giving comfort to the pain. And I commend all of you. I know all of you are those kinds of doctors. We sacrificed our lives at the expense of we sacrificed our lives for our people. Okay. A very good morning to everyone.
One to two questions for Dr.
This is not a question. I just would like to add my observation during the time of the COVID. I also was giving a lot of Ivermectin to COVID patients, relaxing for COVID. Dr. Landrito, I realized I have 2 psoriatic patients. After taking the Ivermectin for prophylaxis for COVID, the psoriasis were gone. So I don't know the mode of action, but even in psoriasis, Ivermectin is effective.
Yes, yeah, thank you very much, doctor, for sharing that. We have a lot of psoriatic patients who are improving. I never knew even carpal tunnel syndrome has an autoimmune element in it. I have seen a patient, all the fingers was aching. She was telling me until she got prophylactic for COVID only. She was showing on my Zoom meeting, look doctor, I have my fingers don't pain. I don't have that. Continue with my, call that, splints. Yeah, it's worked very good for psoriasis, autoimmune disorders, because of its immunopotential, immunomodulatory properties. Thank you, doctor.
Can I ask a question? I feel I'm in good health. I'm 70 over years old. Should I take this every day for the rest of my life?
Yeah.
How much must I take for the rest of my life?
Very good question. A lot of people, my wife has been taking for calcium day for 6 months. She had endometriosis, she had DNC, but then after that she has still metrorrhagia, menometrorrhagia. When she took Ivermectin, the hormonal balance was corrected. She's been taking it. A lot of people are taking it daily. The doctor that I mentioned here, she's among us, she's here. She's been taking it daily. No, if there's anything that can prevent cancer, it's Ivermectin, or maybe rapamycin if we have it available. And we need that. Both my parents died from cancer, and I'm really desperate to find something that will prevent cancer. You can take it daily. It will boost your immune system, and if pandemic will come, you're in a good shape for that. 1 capsule a day. If you're prostatic hypertension, 2 capsules a day, they're maintaining people for lifetime anyway for BPH. With synthetic pharmacological agents, but we have here a natural, what's that? Natural remedy. Why not take it daily for the rest of your life? If you have BPH. Dr.
Yeah, Dr. Allan, this is a comment and also a question. With the with the COVID, we are dealing with not only the long-COVID but also the vaccine injury. I have so many cases, and I want to let everybody know that we use ivermectin more than ever. And we discover a lot because in vaccine injury, Well, my cases are actually immune deficiency. I have two kinds of immune deficiency that I see in vaccine injury. It's both the decline in the CD4, CD8, and as well as deficiency in the production of immunoglobulin or antibody, natural antibody that we have. And so I am not sure yet if it's actually going to affect that. But aside from immune deficiency, we also see what we call turbo cancer. And so with the explanation of Dr. Allan, I think it's a good agent, whether to prevent it or as a treatment. I'm using a lot, like also in unusual high doses. And so I don't know the rate of vaccine injury here in the Philippines, but I do have a lot, especially in the old people, because my population is highly vaccinated, and so I see the cases. I don't know experience here, but we continue to use the agent for that purpose. And Dr. Allan, just to clarify, you're saying 6 capsule or what have you, you're talking about 15 milligrams per capsule, right? Because in the US I have several forms. I have the 6, 12, 15, 18, and 24. And so I just want to clarify it's actually the 15 here, 15 milligrams. That's it.
Yeah, thank you very much, Dr. Now we are seeing a lot of vaccine-related problems. And ivermectin touches on very high affinity on one areas of the spike protein, completely disabling the spike protein from doing this harm. So you give it to vaccinated people, you give it to those having complications with the vaccine, it will work. And now it's about cancer, and also what comes out of this vaccine. There are a lot of cancers. So we don't look at, we don't need to look on stages 1, 2, 3, 4. Doesn't matter if it's stage 4. You give ivermectin, we will be reversing even stage 4. I believe so, because of all the molecular basis for that. And I'm seeing a lot of people are already desperate. Triple negative breast cancer, very difficult case. So they were improving much slowly, but they're improving. You can see the well-being. They start getting the appetite. They start getting the weight. So many things.
Hello,
I need to give the time for the next person. Sorry for
Dr. Allan, sorry. You have experience with psoriasis. What about scleroderma? Do you have education?
No, I haven't seen a scleroderma patient, but before I treated scleroderma with diabetes and foxcycline, it's working with diabetes with another unit.
Sorry, doctor. Do you need to give the ivermectin in one dosing, or can you divide it for the day?
Yeah, we divide it with the patients having visual symptoms. So if you go very high, during the pandemic, people start panicking and they only have ivermectin with them in the Philippines. I can see the Philippines or the population has gotten too much of ivermectin, very high, but there's nothing such a thing as too much, because the LD50 is 10 to 50. So some people will tell them to divide it into 2.
Kasi,
Having these symptoms.
yeah, because I experienced giving ivermectin with my pet. Yeah, and my pet just went berserk, dizzy. The dog, I think I gave about 3 milligrams per kilogram body weight, and then my pet couldn't walk and was very weak. So I was thinking, I guess this is what it does with as a anti-parasitic, right? So that makalabas yung mga worms, right? So that's my question. So if you can just divide it in a day, or just
Rather than sacrificing the dose, you divide it and you get lesser side effects. And as the experience of the doctor there, the case in point we had, she just completely believed after 5 days she doesn't have it. Body tend to acclimatize on high doses.
so mawawala.
Wala na. But then, some patients are so sensitive. One thing we know, ivermectin, I call it the sleep debt collector. If you are been sacrificing your sleep, and if you start taking ivermectin, you really get so drowsy, you will sleep to sleep. And we know during the pandemic, we realized the number one factor that will boost immune system is the sleep. So you just have to sleep it, because if you don't sleep, you'll have dizziness and all that. Ivermectin, that's why even in insomnia patients, I give Ivermectin, they sleep. It's also good for insomnia. But I would say it's more of a sleep condition. If people have enough sleep already, they won't get sleep. Thank you for that.
Okay, so Dr. Allan Landrito is not only a COVID hero, he also is a mass genocide for parasites and cancer. Okay, please.
I would like to invite Dr. Kamen and Dr. Hummerlin for the next conversation. Dr. Allan. For our next speaker, it's a pre-recorded